So here we have a 24-year-old man who's brought to the emergency department 36 hours after sustaining multiple long bone fractures in a motorcycle accident. He becomes acutely confused and hypoxic. Physical examination reveals tachycardia, petechial rash over his chest and axilla, and fever. Arterial blood gas shows hypoxemia, and laboratory studies reveal thrombocytopenia and anemia. Which of the following is the most likely underlying mechanism responsible for this patient's condition? All right, so again, here we can see this happened 36 hours after a long bone fracture. Right? And you can see he also has confusion and hypoxia, as well as a petechial rash. So this is also kind of a gimme, right? So when you see this, start thinking fat embolism, right? So right from the long bone fracture, especially if you see something like the femur was affected or was broken, start thinking fat embolism. So fat embolism. All right. So again, remember, it's going to, like, fat globules are going to leave the bone. They're going to go all the way up to the heart and go through the pulmonary arteries and then make their way to the pulmonary capillaries and block that. So that's where you're going to get the hypoxia from. Okay. Now, it's also going to cause some inflammatory injury, right? Because the free fatty acids are going to cause some inflammation. It will lead to endothelial damage, platelets will aggregate, hence the thrombocytopenia as well, right? So taking care of that. Okay, so that will make the answer B, right? So fat globules entering the bloodstream and causing mechanical obstruction and inflammatory injury. Okay, now let's look at the other options. Okay, so for A, platelet aggregation triggered by exposure of subendothelial collagen. Okay, so this is related to primary hemostasis. So primary hemostasis. All right, so by exposing that, or by having that endothelial damage, you've exposed the subendothelial collagen, and that will cause the aggregation. Okay, so for C, air bubble and bubbles obstructing pulmonary circulation after central venous catheter placement, right? Not really the case here. Okay, so number one, you're going to see the symptoms if it's air bubbles after, as a result of catheter placement. You're going to see the symptoms happen pretty quickly, so not after 36 hours. Okay, so that's for that. So that's out. D, immune complex deposition in pulmonary capillaries leading to complement activation. So this is something you're going to expect if they're talking about lupus pneumonitis, right? So lupus pneumonitis, something like that. Lupus pneumonitis, right? So unrelated to this. E, thrombus formation due to prolonged immobilization and hypercoagulability. Now, this patient is susceptible to having thrombi formation. However, you're not going to see things like the neurologic symptoms, like patient is confused. You're not going to see petechial rash either. All right, so yeah, see you in the next one.